guys. What's up?
Yeah. Hello, everybody. Good evening. Let's see who's here. Archetype, hello. Pokari, hello. Vendix and Ottawa-kun, hello. And yes, our guest tonight is Ratanak, the first Cambodian VTuber.
Hello.
Yeah. He's fresh from surgery. fresh from surgery. Wait, your surgery was like a few weeks ago, I think. Yeah.
My surgery is like a week ago already, so yeah, it's healing up very nicely actually.
Siya yung tutuliin. No, this is not a Tuli stream. This is not a Tuli stream. This is not a Tuli stream. His surgical site is on the neck, man. It's not down there. Bruh. Okay. So yeah, I think I've talked about thyroid before. Let the man rest. I talked about thyroid before, but this time we're gonna go a little more in depth with Ratanak's supposed diagnosis. Yeah. Okay, so let me Rat, introduce yourself.
Yeah. So today my name is Ratanak. I'm like you said, I am first Cambodian VTuber. I been at it for like 4 years now. I'm Shiori here is actually the first person that I collab with, and yeah, I've been like playing Team Fortress 2 with other VTuber for like 4 years now. I collab with a lot of them.
Yeah. And yeah, he plays TF2 a lot.
Yeah, I'm now also a Tokusatsu VTuber as well. Yeah.
Yeah, he is now. Yes, I remember before he didn't really care. Oh my god, you're blurred now. You have become pixelated. you are a blur on my. Okay. Anyway, yeah, I remember before you used to like not care about Kamen Rider stuff, and all of a sudden, won't he strain his neck from talking? Nah, he'll be okay.
No, it actually doesn't.
Don't worry about it. He'll be okay. Oh my god, you shrank. What happened to you?
Oh, what the heck?
What is going on?
Oh, okay. I was like trying to like move the window. It actually like changes the.
Is he clear to talk? Yes, he's clear to talk, man. Come on, they did not touch his vocal cords. Okay, just the thyroid. We'll talk about it later. You are.
Yeah. So.
You are a blob on my screen.
Yeah, give it a bit. It'll buff out probably. I don't know.
You are
a just weird
Cambodian blob right now on my stream. Okay, so no, his neck didn't get What the hell?
What the hell? No. I know we're talking about a woman who is known to circumcise people here, but come on.
Why is he so blurred and pixelated? I don't know.
Try refreshing the thing, maybe the source.
Okay, refreshing the source. Okay, hold on. I'm going to refresh. Wait. You're so blurred. What happened to you? Wait, okay, I'll remove you. Disappear first. Okay, I kicked out Ratanak. Wait. Refresh.
No wonder. Hold on.
Oh, there we go. Okay. You're still blurred.
Hold on. Wait. I think the upload is like kind of weird. When I change VPN.
You think they're saying you got censored like a JAV?
Yeah, hold on. The upload was like fucking up. Let me change VPN. Okay. That's probably why.
Okay, Ratanak got censored like JAV.
There we go.
You could say that Rat is not clear enough. Oh.
There we go. It should work now.
Okay, let's just wait for Rat to appear.
Or try refreshing it again.
Okay. Let's wait for Rat to refresh. Okay, there we go. You're still pixelated.
Weird. Hold on. Hold on. It's fucked.
Oh yeah, you're okay now. There we go. Yeah, there we go. You're okay. Hopefully you'll stay like that, or else you become a censored job. Oh my god. Okay. Low res rat. Okay, so topic for tonight is thyroid cancer, okay? I basically recycled the same slides as before, but I added some stuff. So let's go, right. Okay, first we're gonna talk about the anatomy. Oh wait, first we'll talk about how did this start, Rat? How did your symptoms start? How did everything start?
Actually, I didn't even notice it until like there's a bump on the bottom right of my neck.
A lump on the bottom right of your neck. Okay.
Yeah, I noticed that like 5 months ago. I mentioned it to my mom. We didn't really bother much with it. We thought it was just fat forming there or something.
Okay.
Turns out it wasn't. Yeah, we only found out about it like a few weeks ago when like that incident where I strained the nerve at the back of my head.
Yeah, from playing
like,
VR chat.
Yeah, it causes like my was it the right side of my face to like droop down and like tense up, so I like couldn't move that side of face for a while. And we did like a whole like full body scan and everything. I stayed like in the hospital for like 3 days, I think, while we were like.
Oh, when they were checking.
While we were checking.
Okay.
Yeah.
Okay. So that's 5 months of a lump on your neck. You noticed it, but you didn't. You thought it was nothing, basically, right?
Yeah.
Okay. Oh, basically, VR chat saved his life.
Yeah,
actually, when you think about it, VR chat saved his life because he got a checkup and they found that because of VR chat. Okay, guys. So lesson here: VR chat saves lives. Play VR chat some more. I don't know. Anyway, okay. So so it's usually that's how thyroid cancers start. It starts as a lump anywhere on the neck, usually at the front. But the thyroid has like 2 lobes, so like here, let's go. There we go. This is an image of the anatomy of the thyroid. So this is how your thyroid looks like when it's normal. It's supposed to be this small gland in your neck that's like supposed to be only 20 grams in weight. Yeah. So over here on top is the voice box or the larynx. And then you have the thyroid gland. Behind it, the tube behind it is the trachea. That's where the air passes when you breathe. So it's like connected to the nose and then goes down to the lungs. And then your thyroid has different parts. The right side or the right lobe, and then the left lobe, and then the middle part is called the isthmus. And then behind the thyroid, you have like 4 tiny yellow glands. Sometimes there's more. The parathyroid glands. These are important, especially in thyroid surgery. Because I remember you said you were supposed to be discharged. You mentioned that, but then your calcium went down. It's because of these parathyroid. Yeah. If they removed your thyroid, so there's a chance that probably like one of these parathyroid glands got injured in a way because they're just stuck there. They're just there. So it's important that they stayed in your neck. So that's why they had to really check on your calcium. Because if these are gone, your calcium goes down. Yeah. So, but anyway, I think you're good.
Yeah, I'm good now.
Yeah, you're good.
My like calcium level is like stabilized anyway because back then like for 2 days it was so bad, like she was shaking like.
You were twitching?
Yeah, it was shaking the back of my head and then it like pulled my face to the right side.
Oh yeah. That they call that physical exam the shove stick sign, where they tap your face, one side of your face, and then your face twitches to that side, something like that.
No, it was like it's just like low calcium levels, just so bad, it's like pulled my face.
They don't even need to tap it, I guess. It's just like that. Okay.
Yeah.
And then let's see what else. Also important. Here's another photo. This is a lot of words, but as surgeons we gotta know these things. So in the center is the thyroid gland, and then what's important here are these ones, the blood vessels. So especially the carotid artery. That is a very important vessel. That should not be injured when they do your thyroid surgery. The blue one is the vein, the internal jugular vein. This one actually can be sacrificed when they do a major surgery on the neck, which is like one of the stuff they can remove if during your surgery, the neck dissection, which we'll talk about again later. So yeah, next, and this one is also important, the nerves. So the two important nerves here are this one, the superior laryngeal nerve, which is this, and the recurrent laryngeal nerve. If any of these are injured, if this is injured, the recurrent laryngeal nerve, you will have voice hoarseness. And then if you injure both sides, you won't be able to breathe. You'll be intubated for a while. So yeah, though very bad to have these injured. I think I mentioned this before to you. Like, there's a nerve there that they're gonna watch out for. So if it gets damaged, you won't be able. Your voice will not be like this, the usual, the normal. But yeah, you sound the same, so you're good.
I sound the same, so yeah, I think they did a really good job.
Yeah, they did a good job. They avoided these nerves, which is good. And then if these ones are injured, the superior laryngeal nerves, you won't be able to reach high notes, or you won't be able to make a high pitched voice. So yeah, yeah. So, but the ones, these are a little far up, so it's really hard to injure the ones on top, but it's very easy to injure the recurrent laryngeal nerves. So this is the one you really watch out for. Yeah. And it's good to know that you didn't get any hoarseness, man. You sound exactly the same, so you good.
Yeah.
Right.
I do notice it after the surgery, but I think that's because it's just the anesthetic.
Yeah, probably like immediately after the surgery, you would have some hoarseness because they like did a lot of shit in your neck, and of course, while removing the thyroid, of course the nerve probably got tired from all the stimulating. So, but it'll come back after a while. Okay, next. So what does the thyroid gland do? Alright. So the thyroid gland does a lot of things. It secretes hormones, so there's one called the T3, the T4, and the calcitonin. So T3 and T4 are important for like heart function, digestion, brain development and nervous system, bone health especially, and your muscles when they contract. And then also calcitonin for bone health, kidneys, and also the parathyroid to stimulate the parathyroids. Okay, and oh god, this one is very technical for all the med students out there. All the med students out there, they're gonna ask this question. They're gonna show this to you, and you gotta memorize this. For all the med students there, and for all the endocrinologists, you guys need to know this. The hypothalamus in your brain produces a hormone called the TSH, or the thyroid stimulating hormone, and that's what stimulates the thyroid to produce the hormones back here. And that's when they do their stuff. Yeah. So the thyroid hormones help in bone health, so they help in like growth, in metabolism, and all that. The more TSH you have in your body, the less the less thyroid hormones you would have. Or wait, sorry. The more TSH you have in your body, so the more stimulated your thyroid gland will be, and you would produce more of these T3 and T4. And the more of these would have a negative feedback, meaning it's gonna stop the hypothalamus from producing more of the TSH because there's so many of them. So that's how the cycle goes. And yeah, they asked this in med school. So for all the med students out there, you gotta remember this. You gotta remember this cycle. Okay. As an engineer, everything Shiori says is like magic incantations. Yeah, this is medical terms, okay? Different.
Wow,
language.
how you can like just remove that if you had like something bad going on with it.
Yeah, that's
Just
why.
entirely.
That's why if you have your thyroid gland removed, you would have a lot of this TSH, but then nothing's happening. So you have to have a medication to control the TSH. Because you'd be producing TSH and then like there's no thyroid gland for the TSH to stimulate. So you're just gonna have a lot of this. So I don't know. Are you on meds or did they not give you any meds yet?
I'm on some med. It's like I think it was calcium med, and I forgot the other one.
Okay.
I'm like taking those 2 tablets right now.
Probably, well, maybe one of them's probably to control the TSH, or they'll probably do it after your RAI.
Yeah, they said there's a thyroid related medicine that they're gonna give me, but they haven't given me that yet.
They're gonna wait after the right therapy. Okay. Alright, next. Okay, diagnostic. So, according to you, you had when you had your checkup, you had you had a checkup for that numbness you felt on your face because of VR chat, of too much VR, and then they did like scans on you, right? You said before they did an MRI.
Yeah, they did an MRI.
Yeah, usually MRI is for if they're considering a nerve injury or something brain related, they do an MRI. And you also said after the MRI, they saw the if they did an
more
MRI
like
of
they
your
not
head.
more like they not saw it. I mentioned it.
Oh, you mentioned it. Oh, like, oh, hey, I got this lump on my neck.
Yeah.
Okay, I thought they saw it on your MRI. Okay, so usually when you have when a patient has a lump on their neck, one of the first imaging or diagnostic tests they do is an ultrasound. So yeah, definitely had this done on you.
Yeah, I had that done twice.
Yeah, and based on the ultrasound, I don't know what your result is, but they have this grading. So for any med students or people who want to be surgeons, you gotta know this table. This is a lot of words, but you gotta know this. But yeah, it's a lot of words. But based on the ultrasound, depending on what they see, that's when they decide if they have to do a biopsy or not. So if even your thyroid is graded, more like the tumor they see in the thyroid. So basically, just see if you have a 1 here, benign, you don't need to have a biopsy taken. They'll just like observe it. If it's 2, it's not suspicious. They'll need to take a biopsy. But if it's a grade 3, it's suspicious, but you know it can be malignant or it can be benign. So they just base it off the size, like 2.5 cm. Then that's when they do a biopsy. If it's a 4, then the threshold is smaller, 1.5 cm, and then they do a biopsy. And if it's a 5, it's 1 cm or 1 cm, then they do a biopsy. Considering how big the lump on your neck was, you were probably at like
probably 4, yeah. 4 or 3.
Yeah, I mean, it depends also on the I don't know. If they said it was really suspicious to them, you were probably somewhere in 4. You were probably a 4.
I mean, they like suggested surgery. I mean, suggested, but when they found it, how they like wanted to like stab my throat to like take the sample from it to check if like bad or not. That is bad, so
yeah. It means the tumor, whatever the thing was, pretty large because 2.5 cm. They gotta do a biopsy already, so you're definitely at the 3 and above, probably 4. Yeah. Okay. So next, there are some thyroid masses that extend down to the chest, and it's a good thing yours didn't, because based on the photo you sent me, it was just limited to the neck. And what are you doing? What are you doing? Oh, okay. Okay, I'll wait for you then. Okay, while we wait for Rat, hiding behind me while his mom calls. We're going to, I'm just gonna say that, if there are some thyroid, masses, or like if you have a large thyroid, they can get really big that they extend down into your chest. They can oh, hello. You back now?
Yeah.
Okay. As I was saying, some thyroid tumors can get really, really big that they extend down to your chest. like near the heart. So luckily yours didn't go down there, because if it went down there, you would have another incision down your chest, and they would have to open your sternum, your bones, your chest, just to get that out.
Well, luckily that didn't happen.
Yes, that did happen. That's a good thing. So usually,
because I like didn't notice it, like I didn't like feel it because it's like very normal. So
yeah.
So yeah, luckily they just early stages. I'm assuming because it's like just from the neck.
Yeah, pretty much. But there are some that are like not cancer, but they extend all the way down to the chest. They're thyroid. Yeah, the goiters, they call it goiter. That's the benign ones. They get really big and they just go down to the chest, but they're not cancer. It happens. Yeah. If the doctor is suspicious that it went down to your chest, then they do a CT scan. So aside from the ultrasound, they do a CT scan. And then there's also blood tests. So I'm pretty sure they took some blood tests.
Oh yeah, they had like multiple blood tests on me.
Yeah, you're definitely getting a blood test. There's a thyroid function test. They test your the TSH and the T3 and the T4 hormones that we mentioned a while ago. They're gonna look at that. Because they gotta make sure that your thyroid is not like hyperactive or hypoactive. So, oh here, you had this done to you.
Yeah,
thyroid,
I had that done.
needle. Did they use an ultrasound while doing it, or they just
I have no idea because they covered my face and all I feel was the needle in my neck.
Okay, you didn't feel anything cold on your neck before that?
I don't remember. I just remember the needle being stabbed in my neck.
Okay, so yeah, this is what they do. If they suspect if the tumor is suspicious, they do a biopsy. So you can do it without the ultrasound if you're confident, like, oh, this is the tumor, we just stab it, get some cells, and then we're good. But then if the tumor is a little too small that you can't really like find it easily by just feeling it, you're gonna use an ultrasound and then just guide the needle through it.
Oh wait, I think they did that because they were like scanning for it and then just stabbing it.
Oh, there you had an ultrasound guided fine needle aspiration. Yeah.
I did that twice. One on my thyroid and one on that lump on the neck.
Oh, so they did a biopsy of the thyroid and and a lymph node biopsy. Okay. Sounds horrifying. Well, actually,
it is.
Well, yeah, it is. Some of my patients are like, they don't care because it's just a needle. They're more scared of the actual surgery. Because this procedure takes like a few minutes, and you're awake. You're not asleep because it's just an injection.
Yeah, I still feel it though. It's kind of painful.
Alright, next. Okay, some thyroid is. I'll just go through this one briefly. So, disorders, we have hyperthyroidism. So, this is when your thyroid produces too much of the T4 and T3. So, this is when you have very low TSH. And then, symptoms, you'd have like hair loss, bulging eyes, or like increased sweating. Usually, the thyroid is also really big. You'll have like palpitations, rapid heartbeats, you sweat a lot, you'd like have like you'd be twitching or having tremors.
Infertility? No, I can't get pregnant.
Yeah, sometimes, weight loss, you suddenly just lose weight. Frequent bowel movement, so you have like diarrhea and your nails get soft. Yeah. So, I don't think you had that. I don't think
I had that.
And then the other one is, this is supposed to be hypothyroidism. So, insufficient production of, so it's the opposite, insufficient production of T4 and
Omega, shut the fuck up.
No, no rat. So, hypothyroidism is the opposite. You have your hair becomes really dry, and really fine or thin. Your face gets all puffy. You can also have an enlarged thyroid. You get arthritis. You can't stand the cold. Your skin's dry. You're always tired, and also infertility. Infertility also, and you gain weight. etc. And if you've been pooping a lot this time, you have constipation. Yeah.
Huh.
Yeah, that's usually managed medically. Now here it is, thyroid cancer. So you were recently when they did a biopsy, it came out as thyroid cancer. Though
Yeah,
I
they
don't know.
didn't mention. Yeah, they didn't mention it
They
until like
probably didn't want to scare you.
yeah,
Because
until like they
pretty
like
young.
talk about like the what is it II? Yeah.
Ah, okay,
They're right.
yeah. Because it's pretty scary actually. Because you're young and then you're cancer. I'm pretty sure like any young person, and they say you have cancer, they're gonna get scared. It's scary.
Yeah.
It's really scary. So thyroid cancer. It starts. Cancer is basically cells that divide uncontrollably. So in the thyroid, you have hyperactive cells. They just divide and form into a little mutant tumor over here. And if the larger it gets, so this is like a cross section of a neck. So the pink is the thyroid. The pink one is the thyroid gland, and then the white ring is the trachea, or where the air passes when you breathe. The yellow is the tumor. So if it's cancer and you leave it alone, it can invade the trachea and even like go through the trachea and block the airway, so you won't be able to breathe. So that's how bad it can get. Alright, so okay, there are different types of cancer. Okay, so we don't know what yours is, but I'm gonna guess yours is under differentiated, probably papillary.
It's probably like it's probably the common one.
Yeah.
because
Okay, that it can literally choke you to death. Yeah, it can. That's how, especially when they get really large. So we have different types of thyroid cancer. We have the differentiated, which has like 3 different types, all subtypes. The most common one is papillary. This one I always see. Like 80% of all thyroid cancers is this one. The next one is follicular, which is more aggressive. No, not really. It's worse than papillary. But it's only 10% of all the thyroid cancers, and this one is mostly associated with iodine deficiency. And then there's this one, the Hürthle cell, which is more prone to scatter to lymph nodes. So actually, all thyroid cancers have they can scatter to lymph nodes, but the Hürthle cell is more prone to it. Yeah. And then next is and papillary thyroid cancer actually has the best prognosis because it's the most common and it's the easiest to treat actually. Like if you were to choose which cancer you want, you'd want this. But it's better.
You can't choose this cancer. It's literally RNG. I got the common pole.
No, I mean, of course you don't want to get cancer, but you know, if you were to choose one, if they ever said, okay, you gotta have cancer, you just choose this one. Okay? Alright, so the next one is medullary. So this one likes to secrete calcitonin. Calcitonin makes your bones brittle. So if you have medullary cancer, you're gonna expect some brittle bones or bone pains and aches. And they also tend to scatter to lymph nodes easily. And then, if they make you choose what kind of thyroid cancer you don't want anaplastic. This is the worst one. If you get anaplastic, it doesn't matter how tiny it is or how big it is, you're stage 4 instantly. Yeah. Basically, if you have this one, your days are numbered. I have seen this one. And it's not. I've seen it grow in a span of like a week. It was smaller and it just got bigger until the patient couldn't breathe anymore. That's how freaking fast and aggressive these ones are. These are really, really aggressive. And they kill pretty quickly. So, yeah. So, staging! So this guy's probably stage 1. Why? Because he's less than... You're less than 50... The staging... I just summarize the staging, okay? So if we're gonna stage a differentiated papillary cancer, if you're less than 55 years old, you only reach up to stage 2. Stage 2 is when you have the cancer and it scatters all over your body. You're only a stage 2. Yeah, but if you're older than 55, then it becomes a stage 4. But if you have anaplastic, it doesn't matter how old you are, you're a stage 4, and you're fucked, basically. Guy
I
is...
hope you got a lot of money.
Yeah, because when you have anaplastic thyroid cancer, there isn't much you can do. You can try to remove the thyroid gland, but it'll grow back. It's really that aggressive. Like, even one cell that gets left behind, it just, like, grows back into another tumor. Most of the time, the treatment is, like, just to put a tube on the neck so that they can breathe. That's it. And then, pray for them. It's that bad. It's that bad. Alright, so next. Okay, surgical treatment. Let's see. Only option is to remove the whole neck. If you remove the whole neck, they gone. They're gone. Alright. So, next surgical treatment. So, for thyroid cancer, you have to do a thyroidectomy. So, thyroidectomy, when you say ectomy, it means removal. So, removal of the thyroid. And the incision for that is usually this one right here. So, the incision is just limited to that when you remove a thyroid.
Yeah,
and,
but they had to, like, cut the muscle as well, so they went up to, like, my...
Yeah, because yours was gigantic. Yours was freaking big. And depending on what kind of thyroid tumor it is, if it's like a benign, if it's not that big, you can do like only a thyroid lobectomy where they just remove one side. A subtotal is like they remove most of the thyroid but leave some behind, and then there's a total thyroidectomy where they remove everything. So most likely yours is a total thyroidectomy.
Oh yeah, it's gone.
Yeah, he has no thyroid now.
Yeah, I'm a thyroidless individual.
Yeah. So, yeah, if it's cancer, it's better to remove the entire thyroid gland, so you call it a total thyroidectomy. And then, if you have cancer and you have large lymph nodes, or lymph nodes that are positive for cancer cells, which is probably what happened to you, because they biopsied that and it came out positive for cancer. You gotta remove the entire thyroid gland. And they have to remove the lymph nodes of the neck on that side. So yours was on the right. That's why your incision went from like... Where is that? From here, it went up to your ear.
Yeah.
Over here, yeah.
Rub on the bottom of my ear here.
Yeah. They, You can show your scar. I think your model has a scar. Show your scar. Can you show your scar?
Yeah.
There's a scar.
Right there.
There's a scar, yeah. Oh, God, you're behind me.
Oh, yeah, hold on.
You went behind me. Oh, there
Wait, hold on. What am I doing?
Oh, there you go. See, you can...
Yeah,
okay.
it's right there.
Yeah, so Rat now has a scar even on his model. So, what would have been this scar went all the way up to his, to the bottom of his ear. So, when you do that, when you remove the lymph nodes on a thyroid cancer that has positive for cancers with lymph nodes positive for cancer cells, you do what we call an MRND, or a modified radical neck dissection, and that is a very extensive surgery.
Yeah, it took them like 5 hours.
Yeah, it takes that long. If a thyroidectomy could take like 2 to... Well, depends on how big your thyroid gland is. The bigger it is, the longer it takes.
They also said my neck was a bit shorter as well, so it's like a bit harder for them to like cut through.
Oh yeah, you gave them a hard time.
Hey, it's not my fault. I was born with it.
You gave them a hard time. Bro's thyroidless. Lore accurate. Yeah, his scar is now lore accurate.
Yeah.
Alright, so I will explain. Okay, these are the different incisions they do for a modified radical neck dissection. Yours is like, we call it the hockey stick incision, because it looks like a hockey stick. It's like here and then curves upward like a hockey stick. So this one, it's this one, but only one side, so like that. This one is just, they just do it like this because that's for both sides, but just one, so like that.
Yeah.
And over here is on the photo over here shows the levels of the neck. They call it levels of the neck, or where the lymph nodes are located. So there's different locations. Under the chin is 1, and then under the ear is 2, and then the middle of the neck on the side is 3, and then at the bottom is 4. 5 is at the back of the neck. And
I think that's where the lymph node is then, because that's where I feel like that's sunken. That's because there's like no meat there now.
Yeah, and then 6 is here on the front where the trachea is, and then there's also 7 down here. Usually for thyroid, they remove levels 1 to 4. No, levels 1 to 5. So 1, 2, 3, 4, 5. But sometimes they also remove 6 if there's enlarged lymph nodes in 6. So it could be 1, 2, 3, 4, 5, 6. So it's like a charted map. Yeah, it's like a map. Rat with less meat.
Yeah.
Yeah, less
it's gone.
meat.
They're
Okay.
starting it right now.
So there are 3 types of MRND, and depending on each type, each type just means like what structures were spared or not. So if you have an MRND type 1, they remove there are 3 structures that are involved in MRND. So 1 is the spinal accessory nerve, so it's a nerve that courses through your neck like this. The other one is the internal jugular vein, which is the big vein I showed you earlier, like beside the carotid artery.
Yeah.
And then the third one is the sternocleidomastoid muscle, the SCM, which is that muscle on each side of the neck. This one right here. This big chunk of muscle here, that's the one.
So did they replace his head? No. I still have the same head. What are you talking about? This like Wolfenstein.
Did you? Oh, hello, Brad. They
Brad.
didn't. He thought they replaced your head. Bruh. So, if you have an MRND type 1, you preserve 1 structure, which is the nerve. If you had type 2, you preserve 2 structures, which is the nerve and the vein. And then type 3, you preserve all 3. So basically, you cannot remove the nerve. It has to stay. Everything else can go. Like, you can remove the muscle. Like, yeah, you take out the muscle, take out the vein, but the nerve has to stay. Okay. So, next. Okay, this is actual rat specimen.
Oh, look, it's my meat.
Yes, it's rat's meat, okay? This is actual rat meat, okay? So, oh god. Alright. So, let me
How are your eyes,
describe
kid?
what
You
I
should have put a content warning, but oh well.
No, this is a medical education stream. This is expected,
Fair enough.
man. This is a medical education stream. You gotta expect this. Alright. Good girth on that meat.
Yeah, but she always saw my meat. She said, wow, that's big.
Yeah, rat's got a large meat. It's raw. Why not medium rare? Bruh. Okay, so let me describe what I see here, cause rat's not sure about what exactly they removed. So he showed me this, and I can only guess what was removed here. Okay.
I mean, my thyroid is right there. It looked like it.
Yeah, this is the thyroid. This is the thyroid, definitely, because it looks exactly like the thyroid. It's just larger.
Yeah.
The forbidden tocino. Okay, thyroid sino. Okay, so this is the thyroid. Usually when you remove the thyroid, it's just this, but then he has like this attached to it. I think this is the level 6 lymph nodes. So if we go back, probably this one right here, because the thyroid's here. Probably had some lymph nodes down here, so they just removed that. Okay, that's what I'm guessing it is. And then this lump of meat right here.
Yeah, that's probably just on the side of my neck there.
Yeah, that is most probably this. Whatever they removed here.
Yeah.
It is that. And this one right here, this dark one, I have a feeling is your muscle, the SCM muscle. So they probably did. I'm thinking they did an MRND type 2 on you. Because that's why they removed the muscle. But I'm not so sure, okay? I'm not sure. It just looks like muscle, but I may be wrong.
I mean, they said they did like cut through the muscle, so
Yeah.
I do notice that now because I like move my right arm up a bit. It like feels weaker than like my left arm.
Yeah, there you go. I think they probably removed maybe a piece of it or something. Because this
It's
one
probably
actually,
a piece because
yeah,
it like feels weaker.
Yeah. I don't think they removed a vein, so I don't see any. But I think this right here is a large lymph node. This one looks like a big ass lymph node, and this also. I don't know what this is.
Yeah.
Okay, let me look at the chat. So Tocino got stuck chew.
The right side of my neck just feels, I guess, thinner now. Yeah. Like there's literally no meat on the right side of my neck.
No meat. Yeah. So Rat has no meat.
No, we did not get to keep those.
No, they don't. He doesn't keep those. That goes to the pathology department where they biopsy it. What does it smell like? Well, if I could tell, when I do thyroid surgeries, and then you like sometimes they burn stuff. They have a cautery, so it burns. It's actually thyroid smells like spam. Meatloaf. That is how thyroid smells like.
Yeah, you can't open people before. How does human smell?
It smells like meatloaf. So yeah.
Yummer.
No shit, you're gonna put cancer in your freezer. Yeah, imagine if you asked for, can I have one lymph node? One lymph node. We'll remember that every time. Yeah, when you cook a meatloaf, just think, this is the smell of a thyroid. This is rat's thyroid. So yeah,
yeah, next time when you're gonna like cook spam, just remember this picture.
Yeah. So yeah, there we go. And we gotta also this is actual rat neck.
Yeah.
Actual rat neck, or rat
That's
scar.
from the hospital.
Yeah, rat scar. What is this? Oh wait, is this band-aid from the drain they put on you?
Yeah, they put like 3 tubes of drain on there.
You have 3. You had 3 drains.
Yeah, they have.
Wow.
Yeah, they put 3 drain.
Well, they really took. Yeah, they took a chunk of his neck.
Yeah, this is when they removed like 2 of them.
Oh, okay.
Yeah, you'll notice like in the back there where like there's a lump at the back of my neck. Yeah, that's still there.
Oh, this one?
Yeah, that's still there. It's like kind of like annoying to like sleep on the back, on my back now.
You have a pillow. You have a pillow on your back. I don't know. Oh no, wait.
No, that's really annoying to like sleep on.
Bone. Okay. Oh yeah. Actually, when I look at it now, they really took out a chunk of your. Jesus Christ, Rat! You have really had a huge chunk of meat in your neck.
Yeah, it's just gone now.
Built-in neck support. I think this is bone. When I come to think of it, when I feel the back of my head, this is bone, man. Is it hard?
I know it's hard, but
yeah,
it's hard, but like mildly soft as well because it's like feels like it's a swell on it instead.
It's definitely swollen. I'm pretty sure after this you had a lot of fluid coming out of your neck from the 3 drains.
Oh wait, no, this is actually. Oh wait, no, I just remember this picture is taken after they took off the stitches.
Oh, okay. Oh yeah, it is. You can see the staple scars.
Yeah, they stapled it.
They stapled his neck.
Yeah, I thought they like threaded it, which would be an even worse experience when they like removed it.
They think the picture looks like straight from Resident Evil. Makes me remember of Titans from Attack of the Titan. They took your flesh pilot. Right. My friend's mother kept the extra intestine in a jar when she gave birth to her in C-section, and then when they moved out 2 years ago, they left the jar in the old house in the what the hell? They let you.
Oh.
They let her keep the extra intestine. Bruh. You could have asked for an extra lymph node. Hey, can I have an extra lymph node? And you could just put it like I don't know, put it somewhere in your room in formalin, and just like this is my cancer.
This almost killed me.
Yeah. Actually, I think yours is the papillary. I may be wrong. It might be something else. But you're definitely not in the anaplastic because.
I mean, yeah,
if that
they
was
already
anaplastic,
like.
you'd probably probably not be with us anymore. That's
Yeah,
how bad
I will
it is.
be dead.
Yeah. Formalin with RGB lights. Your lymph node. Lymph node. Put it in a jar and put RGB lights. Oh, yeah, this is my cancer. Bruh. Okay, so let's see. Next, adjuvant treatment. When you say adjuvant, this is usually this is like the treatment or the medical treatment after the surgery. So like chemotherapy and all that for others, but in your case, it's radioactive iodine therapy or we call it RAI therapy. So what do they do? I have not actually seen this. I'm not really exactly sure how they do this because this is out of my. I'm a surgeon. I just cut things and take them off. This is something outside my field. But
yeah, you
they're
cut people
gonna
open and play Tekken.
Yeah. Yes. They're gonna make you take a capsule. You're not supposed to eat salty things or iodine. A food with iodine in it. So yeah, that's seafood. I think they told you not to eat seafood, right?
Yeah, any seafood or salty food, anything with iodine in it.
Yeah,
but Himalayan salt is alright because it doesn't have those.
Yeah, so they're gonna make you take this radioactive capsule, which will radiate. It will focus all the iodine on your thyroid, and then they just like burn it with radiation. So what happens is, there we go. Radioactive stuff goes to your thyroid cell. It glows with radioactivity. They'll actually see it, and then the cell dies after that. So Ratanak is actually gonna turn into Godzilla after his heart. Get ready for Ratzilla.
God damn. It's either that or I'll turn into a Fallout ghoul, and then after like next week, I'll just go on the sleep and goes, "Hey there, smooth skin."
Bro, just wait for Ratzilla. Wait for Ratzilla. He is going to have the atomic breath very soon. yeah. Actually, when you have the radioactive iodine therapy, like you take the pill, the capsule, you're gonna be isolated because you're radioactive, so you'll be exactly like Godzilla, man.
I know. I will be in the room by myself for like probably 2 days, but
yeah.
I think they like have like stuff that for me to do anyway, so I don't like go insane.
Yeah. Oh, new tokusatsu form just dropped. The alternative universe where Rat focuses more on monster tokusatsu form. Ratzilla -0. Oh god.
Damn,
yeah.
Kaiju number 8.
You will become the new kaiju. But yeah, that's basically once you take that, you will be radioactive for like a while. I think it takes a few days before you can actually I think like you have to be isolated, and even if you go home, you have to be alone. No one has to be. You shouldn't be near people because you're radioactive.
I would be like this instead after 1 week.
Yeah.
Put it in the DM.
Yeah, you're basically. So you can actually just I don't know. Wait. When are you gonna have your first
They said that they're gonna have me take one first, see how it goes, and if it goes well, then that's it. If not, I don't know what else I gotta do.
No, I mean like when is your first one?
We're gonna go do that on Monday. Yeah, on Monday.
Oh, Monday. Okay, Monday is the day that Rat turns into Ratzilla, guys. Stay tuned for that new form.
I'm just hoping that there's like, I don't know, they let me use my phone and everything in there.
I'm not sure about that. I don't know.
Yeah, I don't.
I don't know. I have no
yeah,
idea.
sure. I hope I don't radiate my phone.
Oh my god. Yeah, I'm not sure if they will. Probably that you can. I think you can. Does being radioactive make you imagine drag? Oh god. God damn it. New debut stream. Yeah, expect a Ratzilla debut on Monday, guys. He will unlock his final form.
Hey, am I gonna be the first VTuber that gets irradiated now?
Actually, yeah, you could be like the first radioactive VTuber.
Legitimately, because I swallow a radioactive pill.
Yeah, oh my god, we're gonna have radioactive collabs right after.
Yes.
Ratzilla Mondays. He glows in the dark on Monday.
Yeah, thinking they told me that I expect to like have some side effect, like my neck being slightly swollen or something, and I have the need to like puke.
Oh yeah, there's some nausea associated with that.
Mm-hmm.
Let's see, I'm not so right therapy. I'm gonna like Google something right now because I am not.
Did
very
they
well
send me
versed
like a thing for me to like read as well? I forgot to take pictures of it. I'm pretty sure my sister did take
Okay,
picture of it.
Oh, here we go. Side effects of right therapy: neck tenderness and swelling, salivary gland swelling, may look like cheek swelling, dry mouth. You might have gastritis, so some some abdominal pain, probably slight. Dry eyes. Oh, okay. What are the risks? Oh, risks of radioactive iodine therapy. Low sperm count. That is not on the top of the list, yo.
Oh.
Bruh. Well, I think if they're just gonna do like what?
I look up like causes of thyroid cancer, and the top of the list is fucking radiation exposure.
Yeah, but then you see, you don't have a thyroid anymore, so it's okay to like expose you to radiation. So it doesn't matter.
No, like
Okay.
before that, like
Yeah.
I don't think I've been anywhere
Near radiation.
near radiation.
Didn't go anyone who's Godzilla. Bruh. How about, well, it could be genetic also. Yes, genetics. Cancer is genetic too.
Nah, family have no history of that, so it's probably related to like weight gain or something.
Wow. Okay. Let's see. Yeah, let's see. Right therapy. Let's see what other side effects they have here. Okay. Okay, taste changes. Okay, you might have changes in your taste. Huh. That's basically it for right. I think there are just minor
It's just minor side effect that I will probably feel for like a couple of days.
Yeah, if it's just like a one dose kind of thing, then I think you're good.
Yeah, there's only like, I think it's gotta be a capsule. I'm not sure if it's liquid or something.
Yeah. They'll just it's usually a capsule. Well, I don't know. It depends. Maybe they have a liquid form or whatever. Yeah. We'll know. We'll wait for you. We'll wait if you turn into Ratzilla.
I'll give a live update. They will come and detect on me in like radiation suit.
Changes in taste. Now you like to play LOL. Lol. he suddenly does not want to play TF2 anymore.
Damn. I'm into PUBG now. Sorry, guys.
PUBG. Oh my god. Won't that be considered radioactive poisoning of sorts if it has side effect? No, it's like a minor
Not
side
really.
effect. Yeah, just minor side. I mean, if you're exposed.
It's minor dose.
Yeah.
It's controlled as well. Not like exposure.
Yeah. Please invite Dr. League. No! I do not want to play League of Legends! No!
Dear God.
No. Let me just okay, I got thirsty. Alright, anybody, you guys have questions? I think this is my last slide, actually. This is my last, yeah, it is. And yeah, it's my last slide, the Ratzilla. Right, guys, have any questions? We'll entertain them now. It's pretty short, actually. It's pretty short.
Yeah. After like the surgery, I do notice like my right ear down to like my shoulder, right shoulder. Like I don't have feeling on that just yet. It said it'll come back after like a couple of months maybe.
Yeah, cause you have a really big cut on your neck, so the nerves there just got severed. So yeah, it'll be numb for a while, but it'll
come back. They said.
Yeah, it comes back. It takes a while to heal. Nerves take a while to heal.
Mm.
Have you decided name on your beam attack yet? Rat beam? I don't know. Atomic rat breath.
Yeah, I would do that, but I'll get DMCA by Subaraya. Spectrum beam.
Yeah. Will Rat get his body scanned after the RAI? Will you get
yeah, they will probably scan. They will probably scan after like the thing to like check the cells and all that stuff.
Yeah, they gotta make sure they got rid of all the cancer cells in his body, in his neck, or yeah, even in the body. You gotta
it's mostly in the neck, but they feel it might like scattered like to out my body.
Oh, okay. Because if it's that, then you're a stage 2.
Yeah, they fear that might happen.
Yeah, because you have large lymph nodes, so it's possible that it could have scattered. Where is it? Yeah. This one is freaking huge, man.
I'm pretty sure that one is the large lump on the the bottom right of my neck.
This one right here. This
one that I noticed for like months.
Yeah, it is this right here. It is definitely that. God. So yeah, they just gotta make sure that they get all the cancer cells. What's this? Rat has healing factor. Okay. Well, a couple of months yet. Evil Ratanak, hey, wanna play League?
Yeah.
God. I don't wanna play League. No. Alright, any more questions, guys? About the thyroid cancer, about the surgery, about the radio Ratzilla, the Ratarine. Heck, you made him a mutant now. None for now, teacher. Okay, what if I give them a quiz now? I'll give you guys a test now. We gotta give them a quiz.
Oh no, I wasn't paying attention. Oh no.
No, you're excused. You're the patient, man. You don't need... No. Oh god. Okay, wait. Let me ihagis si Pok. All right.
Yeah. Before. After the thing, I think I should be okay to like eat anything else after that. They just want me to back over like iodine related stuff before like the operation. The treatment. Was it conflict or something?
What? Wait, what was your question again?
Post-op and the dietary restriction.
Oh, diet. Just avoid the well, if you're gonna have the radioactive iodine therapy, whatever they tell you to avoid it, because you gotta make sure the iodine is just concentrated on where it's supposed to be concentrated. Where cancer cells are. But
I mean,
other
I
than that,
will
once
be
you're
released from the hospital after like 3 days. They are
yeah.
only letting me in for like 2 nights and 3 days, and then we're gonna be staying at the hotel. So I'm assuming I'm gonna like stay at a hotel for
You're
I
gonna
think like
radioactive rat in a hotel.
yeah, I'm pretty sure I'm gonna be sleeping alone as well. Like they stay a bit further away from me because we're gonna be there for like a week because there's another checkup with the surgeon on next Monday.
Oh, okay, yeah, okay, that's good. That's
Yeah.
Good. As for like dietary restrictions, I think once you're done with the treatment, there's nothing.
Yeah, they
you'll
they
be
just
able
let
to
me
eat.
do it.
Yeah, you
Yeah,
can
they,
eat whatever you want.
yeah. So that's what I'm planning to do after.
He's gonna eat all the seafood he wants after.
No, when I get back, I'm gonna eat the unlimited chicken wing again.
Chicken. yeah,
Look,
yeah.
look, $5 for like unlimited chicken is pretty nice. The the store owner for that chicken place is Filipino.
Oh, okay. yeah, eat. Yeah, once you're cleared to eat anything, go nuts, eat whatever you want, man.
Yeah.
Like, yeah.
I will
losing
stay
your
off
thyroid-
alcohol for a while though.
Okay, yeah. It's like losing your thyroid. There's nothing really.
There's
Nothing really. Yeah, there's nothing. Not like when you get a surgery for the gallbladder. Sometimes you still gotta avoid fatty food because people who have no gallbladder and then they start eating fatty food, they still get diarrhea. So yeah. Go nuts. eat
Yeah.
nuts.
I guess I need like drink more stuff that has calcium in it, so I guess
Yeah.
I'll just eat more cheese.
I have a feel, yeah, but I think after that you're gonna have a maintenance medication now for your thyroid.
Yeah, they said they're
sure.
gonna like give me like medication after that,
Yeah, you're gonna have to take that for life.
and they're gonna like was it check on me like once occasionally for like the next 2 years.
Yeah. That's the follow up. Like, I think at least every 6 months or at least once a year or every 6 months for like a few years. Yeah. So if your cancer's papillary, you're good. You're good. The prognosis is really it's good as long as they remove everything. It's not as bad as like other cancers, especially anaplastic. That one is. Ooh, that one's terrible. Permanently, yes, Buckety. He's gonna have how other
I mean, it's
people
two
have.
pills
Like,
anyway. It
yeah.
should be fine.
just take it like I have no idea how many times you take that. Actually, I don't prescribe
Yeah,
it.
no.
I don't know if it's like once a day.
The pill that I'm taking like now is like for breakfast and dinner. That's it.
Oh, okay. Oh, 2 times a day then.
Not that bad. I just
Yeah. Alright,
Yeah.
any more questions before I start the quiz? Pen.
yeah. Question, teacher. Am I going to die?
Nah, I think you're okay. As long as it's not the anaplastic, you're good.
Yeah. We already
You
found
have-
it out and took it out already, and it's like stage 1, so it's fine.
Yeah. As long as, stage 1 isn't bad. So, yeah, right here.
We're not sure if
Yes.
it's stage. I'm not sure if it's stage 2 or not because they said they would it might like go to other part of the body.
Yeah, they have to see, if it's scattered elsewhere. You're
Yeah.
okay, you're just gonna be Ratzilla. Yeah, actually, you're not gonna die. You're just gonna turn into, Ratzilla.
I mean, there's a like remaining cancer cell which should be easily eliminated anyway. If it is like scattered, they'll like make me take another one, I guess.
You're gonna be this.
Yeah. Hey, now we will be the first Cambodian VTuber who got radiated.
Yeah. Ratzilla, guys. Never forget. Alright, okay guys, get a sheet of paper. We're gonna start the quiz. Number 1.
You'll get brownie point, yeah? I don't know what she's gonna do. I don't know, she'll call you good boy or something.
Side effects upgrades. your side effects of the upgrades.
That's literally what happened in Fallout 76. The radiation gives you superpower.
you guys wait. Rat's gonna have the atomic breath, so he's gonna glow like red or I don't know, blue or pink, and then just shoot like atomic breath.
Hey Omega, ain't that what happened in Stalker? You get radiation, you become I don't know, telekinetic or something.
Alright, question number 1. Let's see, what should I ask? Oh, okay. What imaging diagnostic tool do we use for thyroid tumors? I think I mentioned like 2 of them. Just give one of them. Alright, chat. What imaging? Let's see. CT, ultrasound. Rat will be the new X-Men member. X-ray ni Superman, MRI. Okay, we got. Wait. Okay, only 2 got it right. Ultrasound. Ultrasound is the first one we use. CT scan also. So we got Pokari, wala man mali ka na. You got wrong answer, Pokari. And archetype. Oh god, rat disappeared. Ah! It's rat! Rat has tension and right next to me. What the heck?
Oh well, keep going.
You can I'm just like you can like wear a Godzilla helmet and then you'd be rats.
I'm too lazy to look that up. So instead I transform. 4.
Okay, so
I'm still figuring out the pose, guys. 4. Something like that.
Okay, number 2. Number 2. Most common thyroid cancer. He transformed from all the radiation. Yeah. Okay, number 2 is wait, most. God, I'm using my mouse to write this. Common thyroid cancer. CA. There we go. Papillary. Okay. Oh, at least you guys got it. Papillary. Okay. Okay. Worst thyroid cancer. Number 3. What is the worst thyroid cancer? Why were you spinning? What the heck? Is that your Where's thyroid cancer? What the heck are you doing, Rat? What's going on? Oh my god! What's happening?
God damn, oh my god, you just found out.
What?
Sorry, I got hit by a truck.
Thyroid Pro Max. Anaplastic, okay, yeah, anaplastic. Okay.
Ah, bitch.
Rat's gone. Alright, number 4. Cure for thyroid is isekai to another world. Okay, number 4. What kind of surgery do we do for thyroid cancer that has no lymph nodes? Surgery. Thyroid cancer. There you go. Neck surgery. That's very broad. It's a neck surgery, but that's so broad, yo. Thyroidectomy. Okay, Shinji got it. Oh, RGB rat. Wait, this is rat being irradiated right now. This is
Oh,
you.
no.
This is you when
Oh,
you take
no.
when you go through your right therapy. You're gonna be like glowing different colors when you're isolated.
Do my neck actually glow?
I don't know. You tell us when you when you do your right therapy.
I'm planning to bring my PS4 controller and my phones there.
Yeah. You can ask them if you can bring their stuff. Like, I'm pretty sure you might get bored being isolated. I think you can bring something.
Yeah.
He's gonna blow.
I can mirror my phone to the TV if they have like Wi-Fi.
Alright, next, question number 5. Question number 5, okay. Oh, what do you call the surgery when you remove the lymph nodes of the neck in cancer? You can give like the letters because it's pretty long. Surgery. Neck lymph. Neck. Nodes.
Yeah, after like I think they didn't remove like a, I guess like a piece of muscle or like something there on my shoulder, because when I stretch out my arm out, it's like a bit harder.
Oh, when you stretch out your arm. Yeah, I think they removed that muscle.
Yeah.
The SCO, because until now your neck is feeling weird.
Yeah, it's just like holding my arm outstretched to the side.
Yeah.
It's harder. So like calibrating in like a VR chat is kind of a bit harder.
Yeah, okay, let's see who got it. Okay, Tristem got it right. Modified radical neck dissection, or MRND. This is archetype. If I stayed in the hospital for a long time, I might tell my sisters to buy me 3 gun plus, then the problem will be moving one of my hands because of the IV.
Yeah, they had me, like my left hand was hooked into the IV for like 4 whole days.
Yeah. Man, I got admitted in the hospital once for diarrhea. It wouldn't stop. I had it on my hand for like 3 days too. God.
Yeah.
I was dehydrated.
They hook, like, yeah, like.
What's
I don't know,
funny
I didn't
is
like
I was
ask about them, but they like have that and calcium gelatin or something, whatever it's called. And yeah. It was that. Yeah, it was like medicine and that as well.
The calcium they gave you was through the IV, or they gave you like tablets?
It was through the IV.
Oh, okay.
Through the IV
that was
as well.
Really, it must have been really low then.
It was really low because it was like that one time where I was like sleeping, I couldn't sleep probably because the back of my head where like around where the surgery is was like shivering. It was like shivering bad.
Shivering? Oh, okay.
Yeah,
like twitching.
It was shivering. Yeah, twitching like that, and then it like pulled my mouth to like pulled my whole right mouth to like it's just the right side to like the side.
Okay.
It was really bad. I couldn't sleep. They hooked me up with like morphine for like 3-4 shots of morphine that night.
Wow, morphine. How did that feel?
I don't know.
What, you fell asleep after that?
No, it was still bad. They actually had to like hook me up with like actual like calcium stuff in the IV and like injection as well.
Okay, because I am very curious on how morphine feels like. Because that's a pain reliever. That means I know.
Your doctor, your surgeon just inject that in yourself. Sneak
that's
one
illegal,
out.
Man. That's
Sneak
illegal.
one out.
That's illegal. Can't do that. I may be a doctor, but I can't just do that. Those are one of the restricted drugs.
No.
Alright.
I also discovered what sounding feels like now.
What?
Sounding.
What?
Sounding.
Sounding?
Yeah. Penis insertion.
What the fuck?
You know when they have a tube up
Pounding?
your like urethra.
Oh,
Uterus. Yeah, uterus.
They put a catheter in you.
Yeah,
in your-
after the surgery they put that in because I couldn't. Because I'm like just stuck there
Because
for
you
like
couldn't pee.
a couple of days. Yeah.
Because you had because you were on morphine.
I mean, like after I think like a day or two, they like pulled it out, but I still couldn't like pee, so like they kind of like just put like a tube in, so
Yeah, that's
they
a
can like
catheter.
drain it.
Yeah, it's a catheter because you were on morphine. There's a tendency if you're on morphine. The morphine is usually given through. Did you have something on your back, like on your spine or something for the
No,
morphine? Oh, where was it?
no, they just like injected in, like through the IV.
Oh, okay. But yeah, morphine. Yeah, that's what happens. Tendency to like not pee.
Yeah, I think
Up
it was
the
like no, I
deep
think it was just like anesthetic after the surgery. That was still like warding off. I didn't know it would affect how like my bladder.
Yeah, it does. It does. People on morphine. Sometimes they won't be able to pee. So you had a catheter, man.
Yeah, I discovered how that feels like.
I don't want to know. But I have inserted many.
Yeah, we know. we know
I
that
have
from the 2D
insert-
profession.
I have inserted many, and I'm like, okay, you need this. You need this, and I don't care what you feel. Alright, so...
Doc repacking, yeah.
Doc be pegging. The torture? It's not torture, you only put it in once, unless it's hard to put it in.
Are we
And
talking
usually-
about?
It's usually hard when the prostate is large. I don't think Rat has that problem. He's young.
Nah.
When he gets older, he'll have that problem.
My prostate can enlarge?
Yeah. When men get older, it's natural for the prostate to get bigger. It just happens.
Ah.
It's not normal like to have. It's abnormal. It happens, but you don't want it to get too large that you can't pee anymore.
Ah.
Because you're gonna have a catheter in there for quite a while if you do. BPH, yeah, it's called BPH. This is
Yeah, I
usually
had-
like in older men.
Yeah, I had that. It's just inserted like 3 times.
Holy shit, 3 times.
Yeah.
So like
yeah, I
they
had
put
to
it
pee.
in and then they removed it to check if you could pee on your own, but you couldn't, and then they put it in again, and then
No,
they just-
they had it once after the surgery, and then they removed it, but I still couldn't pee, so they like had like a separate. I think it's like a insertion tube. It's just a tube that like they used to insert in, and then they
they pull
just
it out.
drained it. No, they just drained it.
Yeah,
It's like I
ah.
pee through it. Like pee just like goes out through it.
Oh, okay. And then they remove it afterwards.
Yeah, they removed it after like all the piss is drained out.
Okay, that's straight catheter. So you didn't have like the one where they insert and then hook it to a bag.
They had that after the surgery.
Oh, okay. Okay, yeah. So the first one is Foley catheter insertion, and then the one where they just drained it is straight catheterization, where they just put in and then drain your pee and then pull it out.
Yeah, that's what they did. Like they did that like 3 times.
How did that
Yeah,
feel
like
for you?
still. I know it's weird. I don't like it. Why do people like it?
I don't know. I don't think the people I insert that on like it.
R/sounding. Why do you like it? People who wear chastity. Why?
Aging, oh god, I just turned 27 today. Is my prostate okay? Yeah, you're okay. 27 is still safe. Don't worry about it. I think usually it's around like 40 plus to like older than 40s. 50 is like that. That's when you start worrying about it. You'll know anyway. Like if you start slowly, like the older you get, and you start slowly noticing that it's hard to pee, or that you're walking around and it starts dribbling, or you feel like you can't empty your bladder, like you pee and then the stream is weak and then it feels like you still have more pee after you're done, and that's when you have it checked.
Oh yeah, they told me like hold up like canned drinks as well.
What?
Before like they told me to like hold off like canned carbonated drinks as well before like this
yeah.
treatment.
Yeah, you're gonna have to live on water first.
I mean, I could drink milk and
yeah,
I
no
guess
monster.
Just fine. Yeah, no monster.
No monster for now.
But yeah, after that they said I should be fine for anything else.
Yeah.
Yeah,
everyone in chat.
Thankfully, I'm like not like restricted to any dietary restriction because I do not want to fucking eat porridge again. I fucking hate porridge.
You hate porridge? Porridge is good if it depends.
Nah, I had like bad experience with porridge because one time I had like I think like a stomach. What was it? Yeah, it was like stomach pain or something. We thought it was like a fever or something like that, so I was like hooked onto like IV drip. It was like we went to like a clinic, we hooked on IV drip, and I was like told to like eat like porridge and all that stuff. And my mom like kept like my mom kept like making me eat porridge like so much it's like actually started making me pale.
Well, because it's like soft food. Yeah, that's probably why. Because you might have a hard time swallowing after that neck surgery. So yeah, they just want to make sure you don't choke on your food.
Yeah, I just don't like porridge anymore.
Alright, let's see. Everyone in chat should do a prostate exam for fun. Holy crap.
Yeah, let your doctor finger you.
Okay, let's see. Oh, wait, guys. Well, we got sidetracked. We have a bonus question. Okay, bonus question, guys. before we go. Let's see. What will Rat become after a rye therapy?
I don't know. Either I became a Kamen Rider Shin or Fallout 4 Ghoul.
Rat after rye therapy.
Nah, I don't think I get it gotten deep up because I can still talk normally.
Yeah,
I'm not sure if it's like affect my high pitch though.
No, you sound the same.
Yeah, it still sounds the same.
Ratzilla, yeah, that's right, Ratzilla. Wait for the
I believe Rat will be the first cyborg rider. Bro! Kamen Rider Ichiko is a cyborg. What are you talking about? Literally the first Kamen Rider is a cyborg.
Bro.
This man clearly have never watched Kamen Rider.
No, I only watched one Kamen Rider, so I don't know anything. I just know
this
Kamen
man
Rider
clearly watched Heisei Rider.
That one Shin collab figure of Gojira, Kamen Rider, Ultraman, and
Oh my god, that one. It's just an amalgamation.
Alright, so... Okay, how many passed? I think a lot passed. I think a lot passed. Shin Ratanak.
Yeah, it's gonna be... Yeah, it'll be like Kamen Rider Shin, where I just morph into it grotesquely with body horror.
Okay. Anyway, yeah, I think that's all. Unless people still have questions, that's all.
Quick, flash my thyroid again.
Flash your thyroid. Here.
Boo.
Okay, another here's me flashing rat's meat.
Rat's meat on stream.
This is me showing rat's meat on stream. I should have changed the label instead of actual rat meat. Can you?
Yeah, this is the most you're gonna be seeing of me. Literally the inside of it.
Yeah, those are some big. Yeah, rat's meat is red. I mean, yes.
Yeah, my meat is huge.
Rat specimen. Okay, so but yeah, I think we're good. 1 hour to, yeah. Okay, we good. Okay, I hope you guys learn. I hope you guys learned a lot from this, and also Rat learned more. Do. Yeah, learn more about your diagnosis, your cancer.
Yeah. Well, I only know about that is cancer like last week anyway.
Yeah,
I think they hold off.
Yeah,
I mean, if I told me that I have cancer, I would be less I would be worried, but not as more worried as like my whole family.
Yeah, yeah, because it's really it's like devastating for a lot of people, of course, especially young. You're young and you have cancer.
Yeah.
We learned that Rat is going to be part of Ratzilla -0.
Yeah, that and also like my whole family's trauma because of my dad's death.
Yeah. Oh yeah. Wait. Oh yeah.
Yeah, my dad died from COVID.
Yeah. COVID. Yeah, I
remember.
You went through a lot. And I come to think of it, you went through a lot ever since I first met you, like 4 years ago.
Yeah. Went through
so
a
Rat
lot.
is going to make a full. Yeah, he's on the road to like full recovery. He still has to go through. He still has to go through radioactive iodine therapy and turn into Ratzilla.
Yeah.
So yeah, thank you everyone for coming to my to the stream. I hope you guys learned a lot. I think Rat learned a lot, and at least knows a little more about his thyroid.
I didn't even know this part of the body exists.
You didn't know a thyroid existed?
Yeah, I thought it was just a throat there. That's it.
Oh, there's a lot of
the human body is complicated. I should become a mechanicist instead.
Yeah, there's a lot of structures in your neck aside from the thyroid. It's like the trachea, there's the blood vessels, there's a lot of stuff there.
I did not expect human flesh was. Sorry, you have to see my meat.
I have to see Rat. Okay, anyway, yeah. Lots of fun, guys, and thank you for coming to the stream. Bye-bye, good night.
Good night.
Yeah.